turkey tail mushroom, Trametes versicolor, is best known as a powerful anti-cancer mushroom. But in 2025, new findings added something exciting: potential anti-aging effect. Its main longevity benefits come from three actions: calming chronic inflammation, boosting beneficial gut bacteria, and promoting faster wound healing and tissue regeneration. Because turkey tail grows everywhere, almost on every mountain trail, many people pick it and make tea at home. But here's the key point: there's still low established safe dosage for self-consumption. So, in the second half of today's video, I'll show you the most reasonable and safest intake amount based on actual clinical studies. Wow, amazing, isn't it? I met this colony in the high mountains in early autumn, and tens of thousands of mushrooms were visually walking on a fallen tree, helping it return to nature. Turkey tail belongs to the Polypodiaceae family and is an annual bracket fungus. Its scientific name is Trametes versicolor, and its English name comes from its shape, looking just like a turkey's tail. From early summer through fall, it grows in dense clusters on dead trees, fallen logs, and old stumps. The caps usually 1 to 5 centimeters across and about 1 to 2 centimeters thick, shaped like a fan or half circle. The color is almost dark, with beautiful concentric rings and a surface covered with short dense hairs, so when you touch it, it feels like a soft carpet. The edge of the cap is white when the mushroom is actively growing and fresh, but as it ages, it gradually turns gray-brown. The cap surface is typically dark, almost black, with a white outer margin. That white edge slowly turns grayish-brown as the mushroom ages, but turkey tail comes in many colors. The one you are looking at now has a dark brown, almost black cap. This one has a gray tone mixed with red. Here, the cap is yellowish with patches of white. And this one shows a warm yellow-brown. You can even find soft gray varieties. The underside of the cap starts out white, or white mixed with gray or yellow. As it grows older, it gradually becomes yellow-brown. If you look closely, you can see the tiny pores that form the spore-bearing tubes. During dry season or winter, the floating bodies shrivel and harden but stay attached to the wood. And if you cut the caps, you'll see its inside is tough and fibrous, white or milky white in color. The key active compound in turkey tail are polysaccharide protein complex with powerful immune modulating and anti-cancer effect. Most medicinal mushrooms are known for their beta-glucan based polysaccharide, but turkey tail is unique. It contains polysaccharide peptide or PSP, where polysaccharides are bound to protein, and polysaccharide K or PSK, another well-studied compound, widely recognized for its clinical benefits. Now let's look at the clinical research. Both PSK and PSP have been studied extensively, first across 23 published studies, combining turkey tail extract with standard cancer treatment, showed higher survival rate and lower recurrence rate. In 262 stomach cancer patients, taking 3 grams of polysaccharide powder daily improved 5-year survival and reduced recurrence. In 9 breast cancer patients, daily doses of 3, 6, and 9 grams helped restore lymphocyte count after radiation therapy, and NK cell activity doubled. In 34 patients with terminal lung cancer, taking 350 mg 3 times daily for 4 weeks increased white blood cell count, and in 186 colon cancer patients, chemotherapy side effects were reduced. Second, in patients with oral HPV, turkey tail showed an 88% viral clearance rate. Third, in women with cervical HPV, applying a turkey tail-based gel inside the vagina for 6 months resulted in 60% viral clearance rate. The aroma is mild, a soft earthy scent with a hint of mushroomy, almost mold-like note. As for how to take it, I'll focus mainly on using it as a decoction tea, since that's the most traditional and practical method. 1. You can harvest turkey tail in all seasons. When the mushroom is still moist and firmly attached to the bark, it can be hard to remove, so it's best to pick specimens that have already dried slightly. After harvesting, place them in a mesh bag and air dry them in a shaded, well-ventilated area. 2. In winter, the mushroom becomes too dry and brittle, so spring through fall is generally the best harvesting period. 3. For daily intake, 10 to 30 grams is typical, but it's safest to start with 10 grams. Add it to 1 liter of water, bring it to a boil, then reduce to low heat and simmer until the liquid is reduced by half. This usually takes at least 2 hours. In traditional medicine, turkey tail has been used for immune enhancement, chronic hepatitis B, chronic bronchitis, and even leukemia. Now for side effect. 1. Allergy. If any allergic reaction occurs, stop immediately and seek medical care if symptoms are severe. Anyone with known mushroom allergies should be especially cautious. 2. Digestive issues such as heartburn, diarrhea, nausea, or constipation, and palpitations. If these appears, stop for 2 to 3 days, then restart with a small amount. 3. Because turkey tail stimulates the immune system, it may worsen autoimmune conditions like rheumatoid arthritis or lupus. If symptoms flare, discontinue use. Precautions. Pregnant and breastfeeding women should avoid it as safety data are lacking. 2. Those taking anticoagulant, antiplatelet drugs, or immunosuppressants should consult their doctors before using it. Beyond immune activation and anti-cancer effect, several other proven benefits have been reported. 1. Improvement in autoimmune conditions such as rheumatoid arthritis and multiple sclerosis. 2. Better respiratory function in chronic obstructive pulmonary disease and asthma. 3. And in 2025, new findings add a completely new dimension, regulation of chronic inflammation, one of the major drivers of aging, restoration of gut microbiome balance with an increase in beneficial bacteria, and enhanced wound healing and tissue regeneration. These broad effects are why turkey tail is now being re-evaluated not just as an anti-cancer mushroom, but also as a potential longevity supporting medicinal fungus. One of the biggest challenges with the turkey tail is that there is no firmly established daily dosage for general consumption. In clinical studies, the standardized dose is based on the active polysaccharide PSK or PSP at 3 grams per day. When converted to the weight of dried whole mushroom, this is roughly around 30 grams. That's why for decoction tea, I recommended a safer range of 10 to 30 grams per day, starting at 10 grams, monitoring for any side effect, and adjusting as needed. And if you plan to take it continuously for more than a month, it's best to consult a qualified professional. If you enjoy hiking, you've probably seen this mushroom many times. There was even a period when it becomes popular on TV, and many people collect it from the mountains. But lately, almost no one pays attention to it. Now that you know its valuable, clinically supported benefits, please do not treat it as just another useless mushroom when you see it on the trail.